Hello guys, welcome all to my YouTube channel. So today we are going to discuss about the CVS embryology. So the CVS embryology, that is development of the heart and related structures. So in the overview, I'll tell you that the cardiovascular system's development involves three main parts. All right. So it includes three main parts, that is development of the heart includes all septums and arterial system and the venous system. Let's talk about the each. Okay, so in general we'll talk about in general. So the heart, in this, first of all let's talk about pericardium. So pericardium have three layers, that is outermost fibrous pericardium, and serous pericardium is divided into parietal serous and visceral serous. So where this pericardium is developing, so we need to go back to the general embryology for this. So in the third week of embryology, we can see, so this is the TS of the embryo. So in the TS of the embryo, this is ectoderm, mesoderm and endoderm, and this is notochord. And we can see paraxial mesoderm here and intermediate mesoderm, and this is lateral plate mesoderm. And this structure is along with the ectoderm called as somatopleuric lateral plate mesoderm, and this is plankenopleuric lateral plate mesoderm along with the endoderm. So somatopleuric lateral plate mesoderm along with ectoderm, it forms parietal layer of serous pericardium. Sorry about the notification tone. All right. And the space in between the somatopleuric lateral plate mesoderm and splanchnopluric lateral plate mesoderm is intraembryonic coelom. This intraembryonic coelom, it can form all the cavities which are inside. That is, it forms the pericardial cavity. And so in this complete, look at this complete thing is lateral plate mesoderm. And the structure in between the somatopleuric lateral plate mesoderm and splanchnopluric lateral plate mesoderm is septum transversum. This septum transversum, this is undifferentiated lateral plate mesoderm. So in lateral plate mesoderm divided into three parts, that is somatopleuric lateral plate mesoderm, septum transversum and splanchnopluric lateral plate mesoderm. And this septum transversum is undifferentiated lateral plate mesoderm. And septum transversum forms fibrous pericardium. And what about the splanch? So we see that somatopleuric lateral plate mesoderm along with the ectoderm forms the parietal layer of serous pericardium. Parietal layer of serous pericardium. And intraembryonic coelom forms pericardial cavity. And the septum transversum forms fibrous pericardium. And what about the splanchnopluric lateral plate mesoderm? Splanchnopluric lateral plate mesoderm forms cardiac jelly and myoepicardial mantle. So cardiac jelly means this forms endocardial cushion. And what about the myoepicardial mantle? This myoepicardial mantle forms cardiac muscle and visceral layer of serous pericardium. So we covered all the pericardial layers, that is parietal layer of serous pericardium and visceral layer of serous pericardium. So parietal layer of serous pericardium is formed by somatopleuric lateral plate mesoderm, and visceral layer of serous pericardium is by splanchnopluric lateral plate mesoderm, and in between them there is a septum transversum which forms fibrous pericardium. And here it forms cardiac muscle also, that is splanchnopluric lateral plate mesoderm forming cardiac jelly, myoepicardial mantle. In the myoepicardial mantle it forms cardiac muscle and visceral layer of serous pericardium. This cardiac muscle is nothing but heart. So heart is developing from splanchnopluric lateral plate mesoderm. I think it's clear for everyone. Okay, and I'll talk about the development of heart in our next video. Thank you.